Hi, I'm Ted Kruse with Physical Therapy Solutions, and today we're going to talk about the meniscus. The meniscus in your knee is a ring of cartilage that helps to add stability and cushion to the joint. Each meniscus on the inside of the knee and the outside of the knee are a C-shaped piece of cartilage. Like I said, helps to deepen that sock and add stability. If we look on our knee model here, you can see, so this would be your right knee. The outside of the knee has, you can see the border here, your lateral meniscus. And if we look on the inside, is your medial meniscus. Their main function is to add stability to the knee and add cushioning, or as a shock absorber. They're oftentimes an injured component in our knee, especially with athletic activities, sports. A lot of jumping, twisting activities is an easy way to tear a meniscus. If a meniscus is torn, it oftentimes can be asymptomatic, or the symptoms can subside. If the tear is large enough or in the wrong area, the symptoms may persist and require surgical intervention. Common symptoms of a meniscus tear including catching of the knee, locking of the knee, really sharp pain. It can be debilitating and really limit your function. So oftentimes, in those cases, surgical intervention will be required. Typically, at this day and age, they will do a meniscectomy, meaning they will simply remove the part of the meniscus that is torn or injured, leaving the rest of the healthy meniscus there to supply its function as a shock absorber. In certain cases, they will repair the meniscus, which is great in the long term. It keeps that meniscus whole and healthy. It will delay your rehab. It's a little bit longer of a rehab and recovery, but in the long term, can be a good option. This will be decided by the surgeon. Certain parts of the meniscus will respond well to this. Other parts of the meniscus will not. And in those cases, they will simply remove that torn piece. After a meniscectomy or a surgery for the meniscus, you'll typically do rehab, again, working on things such as range of motion, function, and strength to get you back to whatever you'd like to do, whether it's sports, work, or any hobbies that you enjoy. Sometimes we will run into physical therapy where a meniscus may be injured. Sometimes I'm curious or wondering if they're bruised, irritated. Some of the symptoms are common or consistent with a meniscus tear, but not complete like a tear. And they may not have the catching and the locking like we would typically see with a tear. So we will work in physical therapy to regain range of motion. There's some manual therapy techniques that we can try to take pressure off of certain parts of that knee and the meniscus and hopefully give you some relief that way, and then strengthen the knee so that you can get back to doing the things you like to do. If you have questions on your knee and meniscus injuries or tears, feel free to contact us at our Dyersville or Manchester locations. Thank you.